I think the situation on a world scale is truly scary at the moment, George. As you say, the virus has not gone away and it's got a long way to run. So in the world, we're seeing 14.5 million cases and 610,000 deaths. And perhaps we'll talk about the United States a bit later on, because there it's really running out of control. Here, it's quite clear that lockdown, as you say, has effectively ended. People are going to restaurants. Some people are wearing masks, some aren't. The rules are opaque. People are themselves confused. Even if you're in a hospital, the rules about processing of patients and wards and PPE change on a daily basis. So no one knows quite where they are. Certainly true that essentially there's a far greater degree of social intercourse, and the British government themselves are concerned, giving their mixed messages, wanting to get the economy sorted out. But of course, there's a global capitalist economic crisis, which they're powerless to affect, really. But at the same time, concerned, because they realise now overwhelmingly that there is going to be an increase here as well. I think Chris Whitty was quite clear when he said in September there will be a large increase in cases. He said it very openly. It's unavoidable, and we can expect a large increase in numbers September, October, November. And that's in line with the predictions we've been making based on the evidence that we've been seeing. But it's the most explicit recognition from the government that this is going to happen. They don't expect to have a vaccine ready in time. They're expecting to see a great increase in numbers. People can't be expected to make up their own individual rules. If they're pressured to go back to work, they will go back to work. Economically, they need to do all they can to try and secure their living. But of course, it puts the population at risk. And as we've said, the vast majority of the population haven't been exposed to the virus and remain vulnerable, George.